There we go. I saw I was muted. Hi, everyone. Welcome. We're going to let folks get into the Zoom room here, and we're going to get started just momentarily. All right. Good afternoon, everyone. I think it's afternoon for most of us when we look at time zones that are joining. So we're going to get started right on time. We've got a lot of exciting conversations to get to, and my guess is not enough time to get to them, but we're going to do our best. My name's Molly Cook. I'm the Executive Director of the National Assessment Center Association and have the honor of being your host today and the facilitator. Um, the only logistical piece, I think for most of us, we're used to the Zoom webinars and Zoom functions. The only thing that I will say is we will be holding questions at the end, and we're going to make sure that we leave some time for questions. If you can submit questions through the Q&A function, and I'll try to monitor the chat, but we will make sure to see them if you submit them through the Q&A function. So that would be great. And we'll try to get to as many as we can. So today we're having a panel discussion on developing assessment centers. And you're going to hear from 4 very different jurisdictions who have been through the development process and launched an assessment center within the last couple of years. But before we get started, it's important that we address kind of 2 underlying assumptions that we have when we get started today. One is that we know what an assessment center is, and that you all have some general knowledge of what an assessment center is and its core functions within a community. We're not going to go into detail today on kind of that general topic. We have a lot of resources on our website. The Assessment Center Framework, Assessment Center 101 trainings. We have different publications that you can reference. But broadly speaking, when we reference assessment centers, we're talking about an entity or a mechanism within a community that serves as a single point of contact for youth who are struggling. That can mean young people at home, at school, in the community. So for law enforcement and court contact, where the assessment center's role is to divert or prevent them from either further juvenile justice involvement or even initial prevention, initial involvement, and instead that get them connected to community-based services and supports. So the tagline that I often use is assessment centers are there to connect youth and families to community, not systems. And so when we speak about assessment centers, that is what we're speaking. Again, you can go to our website to get some additional information. The second assumption is that you've read the publication that is really the premise for this panel discussion. I know a couple emails went out this week just to remind you of that. It's the journey of establishing an assessment center. I know we're going to put that link to the publication in the chat here, just in case you can't. But this conversation is really going to build on that publication and dive further in. So if there's references that you hear that you're like, oh, I want to learn more about that, I would go back to the publication. And if not, we'll provide you their contact information at the end. So those are the 2 assumptions. The other thing that I just want to say before we get started is that the road to establishing assessment centers is very windy. And you're going to hear that from the panelists today. Ups and downs. It requires collaboration with multiple stakeholders who oftentimes have different approaches and different goals, different roles and responsibility. It requires communities to navigate and understand federal, state, and local policies and directives around juvenile justice, around child welfare, around police interaction, educational or school processes. So it's very, understanding different stakeholders and their directives and roles and responsibilities. And I would say at the onset, it really requires communities to understand how young people are coming into contact with systems at the present, right? Who's coming into contact with juvenile justice or child welfare systems at what decision points? How are those decisions being made? For what? All of those questions are really important to understand current practice so that we can really get a sense of where the assessment center is going to be most effective in that community to serve as an off-ramp. So all of that current understanding of current happenings is important. It's also important for communities to understand who and what resources are in the community, because when you're serving as that connector, as the assessment center does, you really have to understand what there is to connect youth and families to, right? So today we're going to hear from these 4 jurisdictions about how they've navigated all of that, right? How they've navigated those windy roads, their successes, what they're still working through. So to get us started, I'm going to ask each panelist to introduce themselves and provide a brief overview of their assessment center to give you a little bit of context as we proceed through the conversations. As they introduce themselves, I would encourage you to reference page 2 of that publication. It does have it's a chart. It does have operational details of each center. So as they talk a little bit briefly about their center, you can reference those. So with that, Amy, I will have you start and do introductions.
Thank you. I'm Amy Herrig. I am the interim director of the Bridge Youth and Family Resource Center, which is in Boise, Idaho. I am also the interim director of Ada County Juvenile Services. The Bridge was developed as a precursor to the juvenile justice system, and so it's coming from the county. We launched in March 2023. We were part of an Idaho state initiative to set up assessment centers around the state. The state legislature had surplus funds and wanted to direct them to a good cause. And they selected youth assessment centers and youth crisis centers. And so there was a grant process that we put in, and across the state now we have assessment centers. Ours is primarily focused on prevention and early intervention. Our juvenile justice system already has a diversion program that's run essentially through the prosecuting attorney's office and probation. And we really wanted the community to have the ability to get kids before they get into the system. We work so far primarily with law enforcement. What we had found in Ada County and in the state is that we had a lot of low-risk kids who didn't belong in detention coming into detention because there was no other resources for them. Law enforcement would go out to these families and they would interact with these the kids and their parents that were maybe having some behavioral issues. And by the 3rd call, they're like, we have to do something. And there were no options in the community. So that was one of the reasons why we wanted to develop the center, is that so we could get these kids before they got into the system at all. We have about 400 youth right now that we serve in a given year, and our primary referrals come from law enforcement and schools. Did I miss anything, Molly?
Nope, that was great. Thank you, Amy. Dorcas, do you want to go next?
We'd love to. Good afternoon, everyone. My name is Dorcas Griffin, and I am Deputy Chief Administrative Officer for Shelby County Government here in Memphis, Tennessee. It is probably not normal for a deputy CAO to be on an assessment center call, except that one of the joys of my career in county government was being the leader of the planning and initial implementation of the Shelby County Youth and Family Resource Center. The center has had a couple of iterations I'm sure we'll get into, but really at the heart of why this work became important to our community, it really started as a potential solution to some of the challenges that our law enforcement community perceived with time around trying to meet really complex needs of young people that they were coming into contact with. and trying to address those needs would have them, out of duty for a while. And so, while that started the impetus of us looking at how we could divert young people from the system, but also get them what they needed, it evolved into this wonderful youth and family resource center that does still support law enforcement, but really is about a lot more. I'm sure we'll get into details, but I do want to give a special shout out because I looked through the attendee list and I see that our executive director of the Shelby County Youth and Family Resource Center is here, Amy Call, and she's done a wonderful job actually moving from vision to actual implementation. So I'm looking forward to sharing a lot more with you all today.
Thanks, Dorcas. Laura?
Thank you. My name's Laura Caldwell-Aden. I am the Assistant Director of the Juvenile Court Service Unit in Loudoun County, Virginia. Our Youth and Family Resource Center opened in April 2023, and it was part of a brand new facility that is also home to the Juvenile Detention Center and a youth shelter. But similar to what Amy was saying, we're really looking at preventing youth from entering into the court system and getting them ahead of time. We do have a lot of referrals from law enforcement, but we also have referrals from schools, and we also take family self-referrals. So we've seen about 200, we saw about 200 youth referrals who came into our center in the first year we were open. And we're outside of Washington, D.C. You may have heard of us in the news, Loudoun County. But we're kind of like an exurb. So some of our jurisdiction is very, very suburban, very urban, and some is very rural.
Thank you, Laura. Last but not least, Lisa.
Good afternoon, everybody. I'm Lisa Varon. I'm the Deputy Director in the Office of Criminal Justice in Philadelphia. We are the newest kid on the block in terms of assessment centers, and it's still evolving. I think our assessment center is also a little bit different than some of the more traditional centers, which the framework really allows for. But the story of our center started about 5 years ago when the city was grappling with the 6-hour rule violations. And so at the time, police leadership was really interested in thinking about how to address that. And to their credit, they said, well, let's not just fix the 6-hour rules, let's reform the whole front end of the youth arrest processing. And so that was kind of the impetus to get our project started. We were applied for a Bloomberg Philanthropies Mayor's Challenge Award and used the assessment center as the challenge we were as a city going to work towards. The project had many ebbs and flows. It's really evolved over time. And we're definitely victim to one of those kind of pandemic projects where we had it ready to go. We were going to launch fall of 2020, and then the whole thing stopped because of funding and everything else that was happening. We had a tremendous amount of change in leadership. And so I know we'll talk about this in one of the questions, but the length with which our project took to actually launch had some pros and cons, but really in the end, we were able to, with our stakeholders, really build a comprehensive youth arrest reform project. We exist right now co-located with police. We're 24/7 operation. All arrests in the entire city of Philadelphia come to the assessment center. We do pre-arrest diversion screening. And then we have youth support partners who are civilians that do a lot of the arrest processing with law enforcement. We've created a really cohesive team, done a lot of trauma and adolescent brain development training together. The officers that we work with are some of the biggest youth advocates I've ever met. And they're really working with us to find family members, to look for diversion opportunities, community-based resources, and to think about how we can serve the whole family holistically at that very front end of the system, which we've never really been able to do before. There's a lot of opportunity for co-location and additional programs and services at that front end that our colleagues in probation and the detention center say sometimes we don't know these things about children until they've been in here. They've been with us for months. And so screening and assessing at the front end, we've found a lot of value in. We also have some new leadership in our city. We have a new mayoral administration, new police commissioner. So our model is evolving and changing, and we'll talk about that as we go. But there's a lot of opportunity to keep those basic premises at the forefront of what we do. Just some quick stats. I know that was part of the question. We have to date, we launched December 13th of 2023. So we're not even a year old. We've served about 1,400 children. 200 of which were eligible for diversion. We've had about 300 families come on site for family-based services who were able to during the workday or afterwards. We've had about 450 referrals to community-based services. We've avoided releasable youth going to detention in about 77 cases by really doing some troubleshooting and trying to find creative ways to get kids home. And I think I'll leave it at that because I could go on for a long time. Thanks.
Thanks, Lisa. I appreciate that. Before we get into the first panel question, I want to do a poll to those of you that are on today. I'm going to launch it here just to get a sense. I know from the registrant list, we've got a lot of folks coming from different areas of the countries that I know are at different stages of the game, right? So just trying to get a sense of where are you in the assessment center development process? So exploratory, you're just gathering information. Maybe you've started the planning process to where you're starting to gather stakeholders and really talk about what that could look like. If you're in the midst of implementing some sort of plan to launch an assessment center, or if you're already operational. So if you could respond to that, I'll give it just another couple seconds. And share. So it looks like we have a good split here. So about a tie between exploratory and operational. So the bookend side of the spectrum with the rest of you falling in that planning and implementation phase. So that's really good to know. And I think you'll get a lot out of the conversation today. Okay, so let's start with, we've got about 5 panel questions. We'll try to get to all of them. But to kick us off, let's talk about the planning process, because if you look at and the publication, 2 of you had longer planning periods, which were about 6 years, and then 2 of you had planning periods that were less than 1 year. And so I want to talk about what you feel like were the benefits of your planning periods, and maybe what challenges either a long or short planning period gave you. So to kick us off, Dorcas, I will give you that question first. So yeah, share.
Why did we start with me? We started with me because I had such a windy journey. So I think we probably fall into that category with a longer planning period. But what I would say is it was longer because the first time we opened, it didn't work. So we started planning as a community in 2017. And at that time, we did not have the benefit of a NAC existing. A little known story is that I've known Molly for years because I cold called Denver because I heard that there was some assessment center, something going on there, but there wasn't one place that you could call and figure out like, well, what are some best practices in setting this up? What are guidelines? And so we really had to do a lot of homework ourselves and try to design what we thought would be the best type of center. It did not work. I don't know if you want me to go into why it didn't work, but I would say primarily the short story is we did not recognize how critical the piece of having a neutral convener of of your thing is. And we tried to do it a little bit differently and just ran into some challenges. We were blessed, if you would call it blessed, that even in the midst of our first version in 2018 not working and us making the decision that we needed to possibly stop and try something new, COVID hit. And while COVID decimated so many things, it did provide an opportunity for us to stop and really be able to reevaluate and change course. And by the way, the NAC became a thing during that time. And so, you know, we had the benefit now of some help, some expertise, some boundaries to work within, and just the gift of time. And so getting back to the original question, like, we're a longer time person. So, you know, there are benefits to having time because, hey, you can really be thoughtful about what it is that you want to accomplish with your assessment center model in your community. I would say that one of the things that I reflect back on is that because we ended up having time, I think sometimes personally, I would let perfect get what is it that they say? Yeah, y'all know. Perfect is the enemy of good. That's it. You know, trying to find this perfect place in order to start the work. Because you just have more time to think about all of the things that need to be put in place. And so you really have to balance your preparedness to actually do the thing that you want to do for youth and families, but also understand that you can't wait till the conditions are perfect to do the work. And when you have time, sometimes that becomes harder to see.
I think that, and yeah, I was trying to think for you what that phrase was, but you got it. That was great. Thank you, Dorcas. And I think we'll switch then to go to a shorter planning period. Amy, Boise, Idaho, Ada County, had less than a year. So do you want to talk a little bit about what challenges, that, and maybe why it worked that way?
Yes, I would. So we've been interested in prevention, detention reform off and on over the last 10 years. It's something we're always sort of interested in, but it never really came to the forefront until the state had this surplus of funds that they were putting towards this grant program. And this was one-time money at what they thought at the time. They ended up having 2 years of it, and it had to be spent within a year. So we got serious. And I think it was a complete blessing, and I do call it a blessing. I had that set up that we had a short planning period because government can be so slow and take so long. And there's always this, oh, did you get this person involved? Is this person involved? By having a short planning period, what we had to do is we had a super targeted implementation team of 4 or 5 of us. And I was specifically hired just to implement and plan the program. So for my first year and a half at with Juvenile Services, I did nothing but the assessment center. And we had people out there engaging with stakeholders because money was on the line. We had to have decisions made quickly. So we had folks in the county, the commissioners were on board with it. Our internal support services like IT and operations, they dropped other things to put us as priority. So having so much support to move forward with this, having the state support, and then that short timeline is the only reason like stuff actually happened. Having a longer period, sometimes our launch, I feel like, was a little bumpier, and that maybe it was a little rougher than it could have been if we had a little bit more time. But having all of the resources from the NAC, which I carried around my little framework for that full year and a half, it was well worn. And having the support from the harbor and the JAC, we didn't have to recreate anything. It was all built for us, and we just had to fit it to what works best for our community. So complete blessing to have a short planning period. If we had a longer one, I'm not sure we would be operational.
Okay, thanks, Amy. Laura, let's see if you think the same way, because you had a short planning period too. So what are your thoughts?
Yes, I would agree. We had a good experience with a shorter time frame because we had, like I said, we were part of a new facility opening, and so we had a hard deadline. And we were coming out of COVID, and not only it was our department launching a new detention center and a new shelter. The new shelter was also a new program, but it was a new program for us, but it was an established process. But knowing we had to open in April 2023 because there was a really nice facility that we didn't want to leave empty, gave us a really hard deadline. And it wasn't perfect, but it was good. And I think what allowed us to, we were able to open and tweak, which I think we may discuss later, but we had a small planning team due to some other priorities going on and the post-COVID scenario coming out of COVID. And that allowed us to be nimble. We also did really, we were just building off the information that the NAC provided, and having that someone a while back in our leadership here in the county had that vision of an assessment center, and that was handed to us. And then we were able to look to the resources from the NAC and say, okay, this is how it's done. And we were able to use that and tweak it to our jurisdiction with reaching out to folks. I would also say, having the shorter planning period, when we're talking to stakeholders, this concept is sometimes hard to understand because it's services, linking to services, it's not providing programs. And so we talked to a lot of stakeholders, but they sort of, I don't want to say they kept us in arm's length, but they were sort of like, great, that sounds great. Yeah, when can we come see it? And so it was really only when we were open and seeing kids and they knew that it was a resource that they were going to be able to utilize and partner with us on, then it became sort of more real. And we were, like I said, we were tweaking as we went. It wasn't a perfect open. But I think that was beneficial, having a shorter timeline for that reason as well.
Thanks, Laura. Okay, Lisa, we're going to bookend this question with the 2 long periods. So Philadelphia is about 6 years. So talk to us about how you feel about that, challenges, successes.
I'm certainly jealous of hearing all my colleagues and their hurry up and go, because that was our plan too, to be honest. We had planning money, we had a team, we had all our stakeholders. We're grateful they stuck with us so long. I would say some of the benefits of our very lengthy period of planning were that we did a lot of service design, we did a lot of mapping, and I couldn't agree more with the point you made, Laura, that folks kind of were engaged, but not until we got really close to the end did they start to really think about it. So I think that's an important piece when you think about stakeholder engagement. The biggest challenges with our very long planning time were the changes in leadership and having to, make it a priority when there was a lot of other things happening in the world, and B, convince folks that the idea from a few commissioners ago, a few leaders ago, was still worth pursuing. We had lost money, we had lost momentum. There was a lot of back and forth. I feel like we were always convincing folks, and we were able to prove the concept. That was the goal. When we did have to push, when we got that 3-month window because of a crisis in our detention population, folks were like, okay, go. We had 3 months. And that honestly was a blessing because we actually had all the plans. We were ready to go and we did launch pretty smoothly. We had plans for incremental launch, but everyone said, nope, scrap that, whole city coming this day. And the good thing, the benefit about police directives and the way they function, they send out a memo and then it happens. And so it ended up, when we had the shorter window, because we had so much time to plan and it wasn't a new concept, we were able to hit the ground running. So I think there are some benefits to a short period of time. The challenges were really significant, and we still launched. So I think it's just about how you make it work, and stay persistent.
Thanks, Lisa. So I think all of you in your answers talked about stakeholder engagement, and maybe changes in leadership within stakeholders. What I think just in general, engaging system and community-based stakeholders is one of the most critical parts of developing an assessment center, but it's also one of the most difficult and challenging parts, especially when we're talking about ongoing from that initial, conception and planning process to the actual launch and even beyond that, right? So can you talk to us a little bit about how you approached relationship management with some of those key stakeholders, maybe talking about who those were for you, especially when those leadership positions did change? And what are ways that you've continued to engage them? So Lisa, you went at the end. I'm going to have you go first this time, if you can talk to that.
Sure. Again, I really feel grateful for the partners we started with and are still with us. We had representation from the district attorney's office, defender, community behavioral health, probation, the courts, police, youth and families. And because we were part of this other kind of planning process, we had some technical assistance. We did these fishbowl activities. We really did have people watch what we were doing, give us feedback in multiple iterations. So we had a trauma consultant on adolescent brain development who did a lot of work with us to help us design the space and also to think about how our policies were trauma informed. And all those folks, regardless of the leaders who changed, came and went, mostly police commissioners, mayors, et cetera, stayed with us. And we just had an advisory board meeting this morning where we've continued to engage that group. And what we started doing case studies. So we present some quarterly stats. And then in order to humanize the work, we really talk about specific details of a case and how, from a cross-collaborative perspective, we could all have served that child better or could serve that child better in the future. And we found that that's a really great way to get everyone to stay at the table, because again, it's not to finger point, it's to say, oh, what if you made a referral here, or did this person get involved? And maybe we should still talk about this case because it was something that just happened last week. But it does humanize the work for folks who aren't in it on a day-to-day basis. We've also had a number of other stakeholder meetings. We have a JDAI meeting that some of the same people are in. We have a continuum of care grant, so we're working on that. And we've started to think intentionally about how we maximize folks' time, don't over meeting them, but really make sure we're lifting up the common threads. And so most of those folks have kind of stayed with us. And I can't say enough about the benefit of the case studies and the ways in which it's really brought a lot of our stakeholders together in a really collaborative way.
Thanks, Lisa. Laura, how about for you? What does that relationship management look like in Loudoun County?
So we had challenges at the beginning because, like I said, there was a vision for an assessment center when the new facility was originally planned. Well, not originally planned. It was originally planned to be a 60-bed detention facility. And way back when they decided that that was the need in the 2010s, I guess. And then a few years before the facility was actually going to be built by the contractors, everybody agreed that we did not need a 60-bed detention facility. There was no need to lock that many children up. So it got converted. And at that time, in the planning period for the facility, there was a vision for the assessment center that was verbalized and shared by an assistant county administrator that's now gone. And so when we actually got down to the planning phase of it, the original vision of having it be multiple human services and juvenile court entities partnering just wasn't going to work based on, it was post-COVID, human services and our mental health department they just didn't have staff. It was back when nobody wanted to come into work. Everybody was teleworking. And so they didn't have the capacity to join us in the planning, in the detailed planning. And so we really had a small team just in the juvenile court service unit. And what we ended up doing was doing our planning and then sort of bouncing things off practitioners and our partner agencies, which included those two, mental health and family services, but also the schools and also law enforcement, also the Commonwealth Attorney's Office. So that's sort of the way that we were bouncing ideas. services and in keeping them informed, and they would sort of weigh in on, this is what we're seeing, or what about these kids that aren't going to school, or you know, like I think Amy, you mentioned the domestic situations that law enforcement encounter repeatedly and repeatedly and repeatedly, and they're going on calls for service to the same houses over and over again. And so we got that sort of feedback. And then since we've opened, we are very much collaborating on a practitioner level, where we have weekly case check-ins with not only our shelter staff, but also with Department of Family Services, the schools, mental health. And so those sort of case level working relationships just continue. And we're still tweaking going forward if we're going to expand our population or change our age group or offer different, expand our connections with services in the community and new partnerships.
Thanks, Laura. Dorcas, how about in Shelby County?
So this question is really one, my involvement has changed some, right? Like I mentioned that I was the person who was in charge of leading the efforts of planning and initial implementation. But now we have an amazing, much smarter team that's doing the operations day to day. But I will say, for me, how I communicated and built relationships, even in the planning and implementation stage at the beginning, I still do some of the same things now in a different role to support the center moving forward continually. And I would say the key thing is to listen. And that seems really simple, but I think because there are so many different stakeholders that have so many different, they'll come at you with different needs and their vision. One, you have to be really confident in the goal of the center. And we're very confident, and we're all on the same page that we really want to keep young people and their families out of systems. I think we all agree on that, no matter what part of the county we're coming from. But how we get there, the path getting there looks different. If you talk to law enforcement, it looks different if you talk to social workers, and it definitely looks different if you talk to activists. And so my approach in just managing those relationships that have very different tactics to get to the same goal is to listen to what is being said and to figure out where there are, even when it feels like they don't exist, there are some places where we can find commonality on tactics to get there. It was very, very, very much a hard sell with some of the folks in our law enforcement community initially, when we started talking about an assessment center, and it appeared to them that, hey, will there still be accountability, right? And so, you know, listening to this as something that was a concern, you know, we had to be very thoughtful that we didn't lose sight of not having our young people in systems, but also creating a mechanism by which there was accountability to the process, right? That accountability doesn't mean consequences and being put in detention, but it is something that we all need, accountability. And so just being able to listen and find those places where there is agreement, but maybe you need to massage, you know, the conversation so that each side sees that, you know, what they envision and what they want to happen for young people, we are working together to get there. It's something that we had to be very, very diligent on in the beginning. And as this thing has morphed and evolved, we're still having some of those conversations. We know that we need to grow, and we know that there are a lot of things happening in our community that people want a response to. And so just doing more listening than talking in this phase is really important, so that we are able to figure through, you know, where there are places that our Youth and Family Resource Center can meet the need and meet the desires of what we want to see for our community, and do that. Last thing I'll say is, as much as relationship managing is listening and acting, it also can be a process of telling people no, right? And not being afraid to not try to be the thing that everybody wants you to be, but staying true to what your mission and goals are. I think having the courage to say no and stay the course really has benefited our relationships, honestly. When you show a path, that you're consistent, that you are, goal driven, and that you're going to stay in the lane that is best for the entire community to be better, I just think it builds respect from some of those stakeholders. I would say that the team at the Youth and Family Resource Center are unique because they have the respect of the police, they have the respect of the people that are marching in the street, they have respect of the families and the young people that come in. And I think it is because of the courage to stand and keep doing the thing that we know to do and not trying to do the thing that we can't do, like be a service provider.
Thank you, Dorcas. I know many people took a lot from that response. And I will say, just with the long period and knowing your ups and downs, you have had to say no several times. So I definitely respect that and think that the Youth and Family Resources is what it is today because of that. So thank you for that. Amy, how about you? Relationship management, stakeholder engagement, what does that look like for you all?
Yes. So again, we had that targeted implementation team. So there was 4 or 5 of us, and almost the majority of the beginning of the planning and phase was going out, meeting with anyone we could who might be interested, and really finding some community champions that would support it with us. We didn't necessarily rely on them that they had to do anything, but we wanted them to talk about it and believe in it and kind of work with us. And we had a pretty simple 2-page sheet that we would provide them on what assessment centers are and what we hope to do with it. And we found some really good response right away from law enforcement. Yes, they were a little worried about the accountability, but there was also a type of what's in it for them is, if we're getting these kids sooner, a lot less time that law enforcement is going to spend with them. So there was a certain, we're ready for this center to be open so we can bring kids here. We had great response from Central District Health, from a number of the community organizations right away. We really wanted to pull in our health and welfare department, and we do have folks on our governance committee from that, but health and welfare was going, and still is going through such a transitory phase. They weren't able to be kind of very operationally involved with us yet. So they were someone we really wanted to have as great partners that we are going to be building as we move forward into the future. We very intentionally did not include our prosecuting attorney's office and the court system or the judges as part of our planning and implementation. We let them know what we're working on. We wanted to keep them informed, but we also wanted to really focus on the prevention and not the system, and really keeping them out. And we've had a number of experiences where sometimes if that gets too mixed, that it doesn't go well. So our goal with these 2 groups is we absolutely let them know what we do. And we have a very well-developed reporting program. We have quarterly reports. We have lots of data that we collect. Our goal is to really show the impact that this has, and to show that it's not having a bad effect, that it's actually better for public safety. And we're going to hopefully in the future be able to work with them at a lot more detailed level, especially because our group, the Juvenile Services, is the entire continuum of prevention through the diversion and probation and detention. Because we're involved throughout the continuum, there's lots of opportunity, I think, there to have kids get help and support in the right place at the right time. And so they're not off the table, but at the beginning, we definitely focused on law enforcement and schools and other folks that were champions. So.
I will say Ada County's quarterly report is one of my favorites because you all do an excellent job communicating your impact, both with data and with qualitative youth and family impact stories. It's great. So we're gonna do one last question for each of the panelists and then open it up for questions from attendees. So I would encourage you, if you have, many of you were in that planning phase. So if you have burning questions that you want some feedback from, I would encourage you to submit those. The last question, what would you, for those who are in this planning exploratory phase, what would you say were some of the biggest lessons learned for you all that maybe they could take back and think about when they're going through their own process, or maybe the unexpecteds that for you, were things you wish you knew during this phase? So Amy, we'll start with you.
Okay, excellent. I think, again, with that targeted implementation team, we were so focused on the planning and implementation that when we started transitioning to the operational side, I feel like we were kind of clunky. We had, one of the things we did do well is we hired employees who were going to be doing the work that knew they were joining a startup. They were hired specifically for their ability to be flexible and work with us through this. And so that was something we did do right. But as we transitioned, we had some trouble defining job roles very well, who was doing what. We had a planning committee to help us develop the screening and assessment tools and process we were going to use, but then this committee was not the ones that were actually doing it. And so we did just have a little separation there that if we could do it again, we might be able to do it a little bit more smoothly. But we were so focused on that planning and meeting those deadlines that actually moving to the operational side was, I thought, a little clunky for us.
Thanks, Amy. Lisa?
I'd say two things. One thing that kind of surprised me is we worked really hard. I think this was referenced earlier on messaging key outcomes to different stakeholders. We would make sure that police, to your point, Amy knew that processing time would go down, and that, probation knew we could create efficiencies with the assessment tool. And I think we had anticipated that we didn't do a large public launch. And so because it was in the middle of a mayoral transition, there was a lot of messaging challenges. We intentionally wanted to tailor our messaging, but the overarching message of what it was supposed to be kind of did get lost in translation. So I don't know the extent to which other folks had larger launch events or press releases. Because of a lot of circumstances, we weren't able to do it. But I think that made not what we were doing hard, but for our stakeholders and community and family to understand it. Now, once we launched, it caught, people understood pretty quickly. We always had the philosophy kind of, if you build it, they will come. Not the kids, to be honest, our partners in terms of co-location. We knew the kids would come, but we were able to really kind of create some momentum once we were open and bring folks in the space. And so I would just encourage folks who are in the planning phase to think about launch, messaging, stakeholders in that regard, in a large community, and kind of how you can make sure folks at multiple different levels understand the benefits and kind of have some cohesive messaging.
Thanks, Lisa. Before I tap in the other two panelists, let me just say, I said we all are used to Zoom, except for me apparently, because I don't see the Q&A function on my end, so you all might not have that. So if you have questions at this point, go ahead and put them in the chat, and we will get to them. So just a little mishap on my end, I apologize. But Dorcas, we'll kick the question over to you. So lessons learned, unexpecteds, what would you tell folks?
So one lesson learned, I wish that, in the midst of planning for this, Youth and Family Resource Center, and even having 1.0 and 2.0 of an implementation process of an assessment center. I think that I became very laser focused on advocating for the thing that we were trying to build, right? So the center itself, the Youth and Family Resource Center, which is a worthy thing. It is, serving as a convener of services for our young people and families. I don't think that I recognized how important it was to not just advocate for resources for our thing, while at the same time doing advocacy for the resources of the services that we were sending our young people to, right? And so, I think there probably was a missed opportunity. There was probably a lot of joint advocacy that we could have been doing to really make sure that even as we're trying to better coordinate resources, that when we send people there, that they can actually access it, that those service providers are not, that they have what they need to do the work for our young people. And I think the second thing is just really personal for me. And it may touch a nerve or touch the spirit of others. I think, personally, when you have invested a lot of your time, effort, and just blood, sweat, and tears into a project that you believe really is going to change the world, I think that sometimes if you are not careful, you can have, what do they call it, founder syndrome, and you won't realize that sometimes you need to get out of the way for the next phase to happen. And so it was difficult for me after spending a lot of time in the planning phase, because it does take a lot of work. And sometimes if you're not careful, you will not move out of the way when it's time to get into the operations phase. I am really, really lucky that I have folks that work with me that are very patient and have allowed me to get out gracefully. But I just would encourage you all just to be honest with yourselves as you go through the process, that sometimes where you are best equipped to be helpful in planning, implementation, operations, all those things, you may just be there for one of those seasons, right, where you are in charge, and be okay with that, because at the end of the day, what matters is that the lives of our young people and families are changed. So that's it.
Thanks, Dorcas. I do think the piece about advocating for community-based services and your resources is important because, assessment centers are the connector to community. And if you don't have anything to connect to, if you don't build up your community's capacity to respond to kids and family needs, the assessment center is only as good as their community. So, great point. Laura, what about for you? Lessons learned?
That's my perfect segue. Yeah, perfect segue. Thank you, Dorcas, because our biggest lesson learned was the amount of time that our staff would need to take to connect a youth and family to services. Because we had an estimate that we would really be like doing these great warm handoffs, all within 1 or 2 days, all the warm handoffs we're going to do. And we thought we'd, get the kid and the family, have the referral, meet with them within a couple of days, do our screenings, do our referrals, and then with 30 days would be one and done. And that's not at all happening, because it's usually now closer to 90 days. And this is mainly because we work quickly. Not everybody works quickly. Families definitely don't always work quickly, and it's important that our youth and families trust us and our staff, and you can't do that in one day necessarily. You need to be there. What we found is, we say we're going to refer over here, and then they don't show up for the appointment. Okay, well, what happened? Why didn't they show up for the appointment? And it just takes, we call them liaisons, our liaisons, more time, and that's fine, but it's just a lesson learned. We sort of had this timeline that we thought would be working, for when people would be coming and when we would be, you know, they would be connected and moving on. And that just seems to be extended. And I will also say, and that's sort of, we can see sort of around the capacity of our partners in the community. You know, we're learning who does what best and how we can anticipate response times. And right along with that is we also have kids come back, right? So we kind of thought that would happen, but we might refer a youth and family and they are connected and things are going well, and maybe it's 6 months. But then guess what? School starts again and someone's hanging out with the wrong person, and our people know they can reach us, and that's great. They know they can reach us and they can count on us, but it's the same thing. It's sort of like, okay, maybe we need to do a screening again because things have changed, and now what are we going to connect you with, or who do you want to, you know, reach out to? So those are two things. And the last thing I'll say is for us is transportation, which is a big deal because our county is large and has very kind of limited public transportation. And so even as we're looking at referring youth and families to partners, we have to consider transportation and what's reasonable for them. And that's a barrier we're looking to overcome.
Thanks, Laura. We've got a couple questions in the chat. I'm going to try to get to them. We've only got a couple minutes left, which we knew would be a problem. I am going to put all the panelists' contact information here in the chat so that you all have that. You can reach out to them afterwards if you have specific questions. And whoever wants to answer these, I'll kind of throw them out. So one of the questions was about incorporating youth voice into the planning and creation of their assessment center. Any of the panelists want to talk about maybe how you did incorporate youth voice into that planning process?
I can say quickly, Molly, that we did a lot of focus grouping. We had the benefit of time. We engaged a lot of young people and families. And again, we had them watch like a simulation, if you will, of the process and then give feedback in real time. We also used that pool of folks to hire from. So we have a lot of people with direct lived experience, and some of whom we met through the focus groups are some of our youth support partners now.
Amazing. Thanks, Lisa. Anybody else?
I would say the only thing we did, I wish we could have done more. Ours was, the planning process was not really tailored to that, but we did have some youth who parents would reach out to the juvenile court services for assistance, but there was no offense or anything. And as we were getting closer to opening, we would have some of those kids and their families go through our process just not in our new facility, and they were able to provide feedback on it.
Thanks, Laura. Another question is is about how there's everybody except for Philadelphia is office hours, not 24/7. So how do you handle after hour needs?
I'd like to jump in on that because we have a really awesome setup here. Is in addition to the assessment centers being set up for youth in Idaho, is the legislature also supported the setup of crisis centers for youth. And so as we got established, another organization established a youth crisis center in Ada County as well. And so since we're completely voluntary, we prefer to get the referral and then be able to reach out to the family and explain it and have them come in and meet with us. But if there is a family or a youth in crisis or heading to crisis, they can take them to our community support center and they can get immediate care and immediate care. And then we get a referral from them and we help do the drop down from that, and then doing the continuing case management to connect to community resources. Fabulous partnership. It works great.
That's amazing. I love how you all set that up. So thank you for jumping in, Amy. For the sake of time, I'm going to wrap us up. I know there's a couple other questions in the chat. Again, I put the panelists' contact information. I would encourage you to reach out to them individually for some more information. I just want to thank you for being willing to share today, share your journey, because it takes a lot, and it's a lot of vulnerability, right, to talk about challenges and maybe things that didn't go right. but I think that's where we learn the most. It's not always like, oh, we did this, we planned for this, it worked out, everything went great. You know, we learn the most from the things that went awry. So I really appreciate you being here and being vulnerable. The two things, two resources I want to leave you all, the attendees with today. One is you don't have to be an operational assessment center to engage with the NAC. We have, you know, monthly director circles where assessment centers come together for peer-to-peer learning. We've got an annual symposium. We have a resource library for members. So if you're interested in that, you know, don't hesitate to reach out. The other big announcement that I will say and leave you with, that's very relevant to this topic, is next month in October, the association is releasing a planning and implementation guide for developing assessment centers, which is going to be pretty comprehensive and outlines essential planning steps. So be on the lookout for that. We'll be releasing it, social media, website, email, all the things. But that will is intended to be a resource for the field so that it grounds you in best practice and really supports and pulls from all the lessons learned of the communities like you heard from today. So with that, I know we're right at time. I want to thank you again for being here with us today. Thank you to all the attendees, and we will see you all again soon. Thanks, everyone.